the physiologic problem with PCOS is an ovarian dysfunction. What that means is the ovary doesn't want to respond to stimulation. It doesn't do it naturally. So just giving it hormones doesn't necessarily make it do what it wants to do. So with PCO patients, we have strategies to decrease the ovarian response. And one of those strategies is to decrease the amount of medication that's used to stimulate the ovaries. So, which is much, much less than what we would do in a normal IVF patient. Some people will call this mini IVF, some people call it low-dose stim IVF. With PCOS patients, what we want is we want a higher number of quality eggs and a lower number of follicles, which is opposite of what we try for regular IVF patients, where we want a high number of follicles to get a high number of quality eggs. So starting a PCO patient on a 50 milligram Clomid dose per day is probably a waste of a month, because they will not respond to that level. So in general, I think you have to take a more aggressive approach in using those medications. And by aggressive, I mean high dose, starting at probably 150 milligrams per day and very, very rapidly progressing to 250 milligrams per day. When we move to IVF, that gives us a different challenge, because we know that these patients are going to be super sensitive to the medications, and they're going to stimulate really hard, which means that in an average IVF patients, we'll get maybe 10 to 15 follicles in a stimulation, but with a PCO patient, we'll get 25 to 35. And the downside of that is that they can develop an illness called ovarian hyperstimulation syndrome, or OHSS. So if they stimulate too hard, number one, you can put them at risk of developing this disorder, OHSS, which can make them very, very sick, and there are still women that die in the world from this syndrome, although it's getting less and less every year, because we've learned ways to manage it. So now the challenge is a little bit different. Now we know we can stimulate them, but we actually have to hold them back a little bit. We have to hold them back so that they don't develop the OHSS, and so that we can try to preserve their egg quality.